going to show you what I call connecting the dots. I'd like to show you how the foot and ankle injury is connected to the injury in her T-spine, and the same thing in that the sacral injury and motion restriction is connected to the T-spine. And basically the philosophy is that you need to treat the most inferior, the lowest denominator of an injury when you're dealing with a system like the human body, in which injuries are actually connected and reflexively driven. So I'm actually treating reflexes in addition to simply treating joints and restoring small motions that are lost in the joint. And her current complaints are pain in the upper traps on both sides, and simply carrying a 10-pound purse enhances that pain. And her neck injury, she had a long history of carrying stress in the traps, but a prolonged motorcycle ride in which she was leaning, she was the passenger, and so she was carrying a heavy helmet and leaning forward looking over the driver on the right, and then doing the same thing on the left. That really brought on the injury. Treated it with massage and 4 episodes of manipulation, which helped some, and she still has some residual symptoms, and so we're going to go after that. Now her worst symptom in the upper back is actually midline, and I'm going to show you that one of those vertebrae is rotated, and typically that would cause more pain on one side. So I think what we're going to do is restore movement, reduce the rotation, and when we've done that, we've treated the foot and the sacrum and the T-spine and also the rib that attaches to that T2 segment that is stuck. I think that we're then going to, at that point, we're going to have to look for a non-rotational injury in which there is one vertebrae that is stuck in anterior glide or posterior glide, a symmetrical type injury, but you got to clear the rotational injuries first. Medical history basically negative, had a tumor removed from the forearm, and that's it. She's had some low back pain on the left side for about 5 years or so, related to a heavy lifting injury, and she recovered from it, but she'd always have some residual symptoms. And I noted that she had increased muscle tone on the left when she was in the child's pose yoga position, and she would note pain would return whenever she would twist. Now running has helped her to increase her muscle tone and stuff, but there's still mild symptoms there. So I started looking at her foot and ankle, and we're not going to do a real close-up here, we're just going to give you a general sense of what I found. And what I found was that she had some restriction in the left fibula and in the cuboid, 5th ray, and also in the subtalar joint. Now on the left side, when I push down on her fibula and I take up the slack on that lateral malleoli, I can spring it, and there's a normative accessory motion. When I push on this one, it's prominent, and I can't take up the slack, and when I put more and more force, I still can't create movement. Fibular head had good mobility. The 5th ray is out here, and when I test superior and inferior glide, it's tighter, much tighter than on this side, not quite as free. And this cuboid bone here, which you won't be able to see, but it has nice superior inferior glide when I isolate it, and this cuboid is prominent, and when I isolate it and I try and move it up and down, it really is stuck. Now a lot of people can walk around on the planet with these motion restrictions. They don't know it and they don't hurt, but it does make her vulnerable for an ankle injury. And the fibula is inferior. This one, I can take up the slack in it and I can spring it and it moves. And this one, I was surprised. I could take up the slack a little bit. I thought it would be missing, but beyond that, I cannot induce any passive motion. Heel rotates nicely both directions, and at end range I can overpressure and it moves still. This one moves freely this way. The heel does not move outward. The terminology sometimes is confusing, but that definitely is stuck. And so what I said, you're basically twisted left here. Somewhere in your body you're going to have to twist right reflexively to compensate. Can you get in muscle and prayer position? Now when she was laying prone, everything looked fine in her low back and sacrum. However, most injuries happen in flexion. So when you put someone in this child's pose yoga position, this is where you can discover some injuries that you will not notice in standing, not in sitting, and not in laying prone. but you'll find them in this position. In this position, I noted she has a lot of muscle tone here on the left side. Something's driving it, so you go to the top of it, and then you go through it all the way to the bottom, and what I found was her sacrum is twisted about the oblique axis. The lower quadrant is prominent and stuck. So I come onto her sacrum. I'm on the top on the left, upper left quadrant. I can take up the slack and I can spring it. You can see her body accepts that force. On the right upper quadrant, I can do the very same thing, and her body accepts that and it moves. And on the right lower quadrant, same thing. And when I come over to this side, I'm doubling the force and I'm not getting anywhere. It's like pushing a brick wall. Can you feel that, Catherine?
Mm-hmm.
What does it feel like to you?
Just pressure.
Could you feel the other sides move?
Mm-hmm.
And when I push here, am I pushing with the same force?
I believe so.
Okay. Can you feel motion?
No.
Okay. So your sacrum is twisted. It'll carry L5, but when you straighten out the sacrum, L5 95% of the time straightens out and behaves and moves normally after that. Check the rest of the spine, and what I found was up at T2, that's where she rotates right. I did screen the upper cervical spine because most people compensate in the upper cervical spine. In this example, this is connected because she's rotated left here, rotated left in the lower extremity, but up here, counter rotates to the right. And when I come on to T2, I can spring her on the left, and the right side is prominent, and when I try and spring that lamina or that spinous process, it doesn't move. When I come out laterally to the second rib on the right is prominent, and I cannot spring it. It's stuck, whereas if I come to the third rib, I can take up the slack, spring it, cleared the first ribs, and if I show you the second rib on the left, you can feel the prominence of that rib. Take up the slack and spring it, and it moves. So this right rib is stuck. I'm going to treat her, and we'll come back and I will show you the treatment effects. Thank you very much.